Let's go on to brain development. And most brain development takes place, you know, in infancy and early childhood. We know that the brain is a plastic organ. It doesn't mean it's made out of plastic. It means that it's still growing and forming and changing into mid-20s. But the most vulnerable period of time is in infancy and early childhood. And when there's a lot of stress around a child, an infant and a toddler or preschooler, oftentimes we'll see a smaller brain size. So that's not a good thing. That's just, again, just common sense. You want to have an average to normal size brain. If you have a smaller brain size, that could mean that you might have learning difficulties and learning disabilities. Also, because of the distractions and the constant vigilance, having to look out for what's going to happen next, there's often less efficient processing. The child and infant feel less secure. They can't process what's going on. In a healthy family, somebody might read to a child, might explain this is going to happen, this is going to happen. But in a family that demonstrates chaos as a result of severe parent alienation, there's going to be trauma and there's going to be less efficient processing. And there may also be impaired stress response. So there could be an overreaction to stress, or there could be an underreaction to stress. So when a child overreacts to stress, they tend to act out, they tend to cry more, they tend to whine more, they tend to get into more trouble, more mischief, because the child wants to change the subject from their mom and dad fighting to have the focus on the child. The same on the opposite end, you might have a child that withdraws, that curls up in a ball, that doesn't come out and play, that seems lethargic, doesn't have a lot of energy. So that's the impaired stress response. Let's talk about physical health next. And physical health, we run into sleep disorders. Very simply put, the child wants to sleep too much, or more often than not, erratic sleep. And this is particularly true now as children age up into the 10 to 12-year-old group, and particularly teenagers. You see a lot more sleep disorders where children are sleep deprived because there's so much chaos in their mind, and maybe chaos in the house from severe parent alienation, that they don't feel secure and they can't sleep. You also may see eating disorders are very common. When you see children that have eating disorders such as bulimia or anorexia, or are overeating with comfort foods to trigger brain chemicals that make them feel good, you'll often find a dysfunctional family, particularly in high conflict parent alienation cases, is like really so evident. As a result of that and the constant stress, you can get a compromised immune system. So what does that mean? That means that you might be more susceptible to colds and flu and even autoimmune diseases. Those are diseases where your body attacks itself. And that compromised immune system also can cause inflation inflammation. But inflammation can also affect all of your organs, and particularly your cardiovascular system. That's your heart, your veins, and your arteries. And that can result in the long term in heart disease. Sometimes you see the heart disease in children and adolescents, but more often than not, it appears in adulthood, and it's usually in the form of high blood pressure, valve problems, and those sorts of things. And you won't be surprised to discover that children that have grown up in a very traumatic environment, particularly if there's been severe parent alienation, often have a shortened lifespan.